Our goal today is really to present to you a solution that we have brought forth for the large employers, right? And large essentially is anyone over 50 lives required or mandated by the government to provide healthcare benefits. Right? And these large employers can cover almost close to about 100 million lives in various forms through our economy. So it's a huge segment. And we wanted to make sure that we were able to tap that market. But in doing so, we wanted to create a system, create a mechanism so that these individuals, these employees, were really going to drive the cash market in doing so, right? And so, because at the end of the day, as many of you, I think, on this call have seen, right, we are a virtual community of cash pay patients and providers, right? And providers, of course, come in all varieties. It's physicians and chiropractors and therapists and what have you, right? And our goal basically is to be able to connect that user, that consumer, the employee directly to the provider. Because we know if we could do that, we would be able to drive the best price point and, of course, the best value in that way. We, of course, run everyone through our software ecosystem, which is quite comprehensive. You have, advocates and agencies that are really feeding the system with users. The users are made up of course, individuals and employers on one side, and then providers in terms of doctors and diagnostics and imaging centers and so on the other side, right? And of course, where we kind of sit in the middle as that connector of the user with the provider. We're, of course, supported by a fairly large cast of partners that really come in and provide their services at different point through the back end, right? And we say it's the back end because if you are using our app and so on, you likely would never see any of these names and would certainly not feel that you are being connected to so many different partners at different points of your care. What this has done is that it has allowed us to build a community, right? So we have almost 1,100 imaging centers. We have close to about 6,000 ambulatory or outpatient surgical centers that have signed on. We have our pharmacy benefit group is going to give you access to over 65,000 pharmacies, including your big box retailers like CVS and so on. And because we are partnered with Quest Diagnostics, if you need any labs done, you can go to up to 8,000 collection sites throughout the country. Of course, you can get your labs done by your physician as well, and Quest will pick that up, right? So this is sort of the ecosystem that's available today. We are in the process of a very formal launch in about the next 2.5 weeks, where we can start to bring in users, those cash pay patients that perhaps are looking for one of these services. But then, of course, we provide our members that are enrolled in our care plan with 24/7 navigator support. We get them 24/7 physician consultation in terms of telemedicine, which of course in this COVID environment has become a big way for individuals and consumers to be able to connect with medical providers. And then we also bring telepsychiatry and counseling services. As you can see, all of this community that we have built so far is essentially geographic independent, right? So regardless of really where you are in the US, if you are needing any one of these services, you can likely find a provider near you. So our target was that as we build this cash market of users, we've got to be able to leverage all of this work and be able to reach out with a value proposition to the large employers as well, right? So that we can drive that market. A marketplace obviously is only as good as the numbers it brings. If we have 1 million users, it's going to be really easy to bring on 10,000 doctors who are willing to provide their services on cash basis. So when we talk about this insurance plan, right, we'll go into a little bit about the structure of it, right? So first off, it is ERISA compliant, which makes it, of course, ACA compliant as well, and it meets all of the sort of regulatory and government requirements for a health plan. Okay. It is built on a self-funded chassis, which means that the employer is self-funding this particular plan, which is why we usually need a minimum of 25 to 30 lives. They will go a little bit lower than that with a questionnaire, but ideally we want to target 25 and up. Certainly the larger the group, the better it is, because obviously you're spreading risk over a larger population, right? We call it, it's a minimum value plan, which kind of goes into that whole ERISA compliance thing. But the way it's set up is that every employer that comes in basically has two accounts. You get an HRA account, which is going to be funded by the employer, right? But money is taken out of that account and given to the employee. And when that employee takes those funds, they can turn around and use those funds like cash on our marketplace, right? So that's how we can really drive not only the volume, but then the ability for that consumer to have money to spend, which of course makes the marketplace a lot stronger. But then if you have a major medical event, then we have a stop loss insurance program in place, which kicks in. So in case, for example, you end up in the hospital, you have to go to the ER, God forbid you get diagnosed with cancer, right? So any of these sort of large ticket items in healthcare, then the major medical insurance plan kicks in. And we say that, you know, so you can see the limits, it's 20 to 40,000. $20,000 is the outpatient spending limit for an individual. $40,000 is the outpatient spending limit for a family, right? This money is not being used towards covering any of your major medical expenses. That comes out of a completely separate account. So when we talk about implementation of the plan, you know, the first thing that our members, of course, get is they get enrolled into the care plan. That gives them access to 24/7 navigator support, that gives them access to telemedicine, telepsychiatry, and the medication program. They then receive a preloaded debit card, an actual plastic card in the mail that's preloaded with either $500 for an individual and $1,000 for a family, right? And that is going to arrive so that if you have any healthcare expenses that are coming up, you don't have to ask permission. You don't have to get any pre-authorization. There are no co-pays or anything like that. You can just use this money like cash to really drive that cash market again. We already kind of went over the fact that outpatient expenses are paid out of the HRA. If you need anything more than the $500 or $1,000, then you go into your WoW app, you create a request with the TPA, which at this point is HMA out of Arizona, and they will adjudicate it for necessity, right? Because their goal is not how much it's going to cost, what have you. Their goal is it medically necessary? And if it's medically necessary, they will give you, again, like cash, out of your spending account, 150% of what Medicare currently is paying. So for example, if a procedure that Medicare currently is paying $8,000 for, and you requested that procedure, the HMA is going to take out $12,000, which is 150% of $8,000, right? So they're going to take out $12,000 and give that to you as a one-time allocation. Now, you are free to do two things. You can follow HMA's guidelines and go to a provider who will do that procedure for you, or you can go off on your own, come to the WoW marketplace, find a provider who's going to do that procedure, and now you know what your budget is, right? So you know that you have $12,000 to work with. If you go over 12,000, you're putting the difference out of your own pocket. If, however, you stay under 12,000 in this example, right, then you'll get to save that amount and you can use it for any other healthcare related expenses. Once again, no questions asked, right? And of course, at the end of the plan year, any unused funds will go back to the employer. So that's kind of what I was just referencing. And then, of course, in the case of major medical events, right, we have this structure where you pay the $500 copay. So if in case you go to the hospital, you go to the ER, it's $500 copay plus 15% of the total insurance, of the total bill, sorry, not insurance, total bill, right? It's a zero deductible plan. So as you can see, the plan will start to participate in your expenses from the first dollar onwards, so to speak. So let's say I go to the hospital and my ER bill is $5,000, right? Or let's make it 4,000 because easier math, you know. So if it's $4,000, I'm going to pay 15% of that 4,000, which is 600, right? So I'm going to end up paying $600 for that visit. Of course, I am protected as a consumer with maximum out of pockets, right? So as an individual, my maximum out of pocket is 5,000, and as a family, it's 10,000. So what is it in it for the employers? Why do they like it, right? So when we talk about it this way, you know, so it is a platinum rated plan. These ratings are actuarial numbers. This is not obviously subjective. It's not like we think it's platinum and therefore it's platinum. It's actually actuarially rated platinum, which means that 93% in this case of the expected expense by a consumer will be picked up by the plan, either through the HRA account or the major medical, right? But it's the consumer, the employee, is only going to pay about 7% or so. When we compared this plan on savings, if you guys are familiar with reference-based pricing plans, you are going to get at least a 15% reduction on your premium upfront compared to an RBP, and compared to a bronze BUCA plan, you're going to save about 25% or so. This is upfront savings because you will get some savings on the back end, right? Because in the plan, the way it's structured, any unused funds at the end of the plan year come back to the employer. So actuarially, you know, you're looking at about 25 to 30% savings on the average for an employer. The great thing is that it is a zero employee cost to participate. And the reason we, of course, made it this way is because we are asking the employee to do something different, right? We're asking them to download the app and sort of, you know, be a cash consumer and really be part of the marketplace and, you know, be price conscious, not just blindly drop your Blue Cross card and think that somehow everything is going to be taken care of, right? So we wanted there to be a financial incentive for the employee as well, so that they are seeing a little bump in their paycheck by not having to pay a premium through their paychecks, right? This is what I was referring to, that up to 60% of your maximum spend as an employer is actually in these what are called recoverable accounts. So any unused monies will come back to you. And that's what kind of gets you your final savings to be in the 25 to 30% range as an employer. There are no networks because, of course, you can go to any provider you want. You want to tell them that you are a cash pay patient and, of course, get the best price possible so that your dollar that is allocated to you, it goes the furthest. For your major medical side, for your insurance side, we use a two-tier system. So all emergencies, it's a 15% co-insurance of the total bill. And if it's an elective, let's say major surgery, you need open heart surgery, right? Then it's 15% if you go to our recommended facility by the TPA, or 30% coinsurance if you go to a facility of your choice, right? So it's two-tier model. The thing is that, the maximum out-of-pocket still applies regardless which model you go through. As I mentioned, it is a zero deductible plan. And then you do have this 24/7 navigator support, which is an actual person that you can call with any questions so they can assist you with that. From an employee standpoint, as we kind of already alluded to some of these, right there, it's a zero cost to participate. You are getting sort of upfront money at the beginning of the plan year to really take care of your routine care without having to come out of pocket for anything, right? You have a fairly well-defined outpatient pool of monies that's available for you. It is a zero deductible major medical plan, so the plan does start to participate with you from the first dollar onwards. And then if you do need to use this major medical plan, it's a fairly simple structure of how that works, with a protection on the upside from expenses with the maximum out of pocket that's actually more reasonable than you'll find in most plans. And then of course you get the 24/7 navigator support. So the question of course always is, why would a licensed broker or agent want to work with us in presenting this plan? Because it is advisor focused, right? So this particular plan, you have to be a licensed agent to be able to present it to your clients, to your employers. But your traditional revenue stream currently as an advisor is either you are getting paid a PEPM, a per employee per month revenue, or sometimes you have a savings sharing alternate arrangement with the employer. So if you, for example, are going to save them X amount, you'll get a percentage of that X amount. That stays intact, and we are not going to touch that side of it, so you can continue that line of business as you are. What we are going to do is give you the ability to build equity, and we do that by saying, hey, all of these employees that are going to enroll into the plan and download the WoW app, let's say they leave their employer, but they continue to use the WoW app to obtain medical services. Well, every time they spend $1, as long as they're on the WoW app, a percentage of that dollar is going to come back to you, right? And if you know medical providers and are interested in bringing on medical providers in your geography, in your location, to present their services to these cash pay patients, and every time that provider serves a patient, regardless of where that patient comes from your employer or someone else's, right? Every time they make $1, you'll get a percentage of that dollar, right? So the idea is that now you can really start to build equity from all of the work, the network that you have built over these years, and become not necessarily entirely independent, although you can, right? But certainly supplement your traditional financial model. So we had presented this to a group of employer benefit advisors who currently are going through training on this particular model, and they will be done with their training in about the next week and a half or so. And then they're tasked with bringing some employers so that we can start to roll this plan out. Our goal is to have this plan functional in the marketplace at the beginning of July. So this is sort of, our next steps, which you can see here. It doesn't necessarily apply to this, but it's something that we have compensated them for their time, so they're really motivated to kind of bring this plan to the market. And I'll stop here and see if there are any questions, comments that we can perhaps address.
Okay, that was very good. Thanks very much. I appreciate that run through. You know, one of the things that is quite nice about this from an employee standpoint and I've heard this over the years from a lot of employers, you know, here I'm spending all this money on this health insurance plan for all my employees, and they're the most ungrateful bunch ever. Because effectively they're young or whatever, they hardly ever get sick, they don't use it. So to them, it's just a bunch of money coming out of their paycheck. So here, that's not so noticeable, but even better, they've got that allocation of money, because that's the challenge of having a health thing at work. I've got things I have to spend money on that my health plan doesn't apply to. So I'm still spending my own money anyway, even if my employer thinks they gave this thing to me. And now you're giving them kind of mad money for the stuff they're realistically going to run into, which is what I really love about it. Because now they're appreciative as an employee of this health program for a change.
Yeah, you're absolutely right, Jeff. I mean, you know, I think we, you know, when we started talking about this marketplace, you know, I would frequently get people and they would say, okay, this is awesome. This is great, right? But what happens if I have a heart attack? And you're like 24 years old, you're not going to have a heart attack, right? But that's the fear. And so then we did step back a bit, right? And we said, hey, you know, let's come up with some strategies so that we can provide that peace of mind to that consumer who may be thinking about a major medical event, right? And of course, we do that for our large employers, what we were presenting today. But you know, one of the other offerings on our platform, of course, comes through your group, where we present medical cost sharing, right? So we present Sedera that's tied in a couple of different ways. So I think that, you know, you'll find consumers landing in different price points, and depending on obviously their life needs. You know, someone may be okay with just having a hospital indemnity program, which is not really ERISA compliant, ACA compliant, or anything like that, right? But it meets their need at the moment because it costs about $50 a month, but it's going to cover them against any costs if they get hospitalized for up to $50,000. Now, it's not unlimited like health insurances and so on, but it gives them an opportunity to have some protection against an illness that is unforeseen.
Right? Well, and what's good is it gives, instead of trying to be that one size fits all, which of course puts it out of reach for everybody at the bottom half, so to speak, they can build and mix and match until their income's up or their circumstances change and get to where they ultimately want to be without just either having to forego it because I just can't afford it, or everything else sacrificed because I'm just choking on this premium cost to maintain this thing. So it's definitely a much more ethical way and allows the consumer to be in charge once again, both of their money and the decisions they're making, what they do with it, which is fabulous. Paul, I see you got your hand up.
Yeah, thank you. And great presentation, by the way, great information. I like the risk controls. You know, you've got a ceiling on your out-of-pocket expenses. So there's some nice built-in risk controls, you know, employee or an employer for that matter. But my question would be getting back to the obstacles kind of going forward. You know, you had mentioned the licensed broker issue. Can you think of any other major obstacles, challenges, you know, with trying to get people on the hook for this?
Yeah, so one of our bigger challenges, right, of course, is that you go to an employer and they say, okay, this is wonderful, right? I like the idea, I like the savings, and you've got a decent community of healthcare services. But what about that brick and mortar, that primary care doctor that my employee may need to go see? Or what about that cardiologist or that surgeon they need to go see, right? So what we do need to do is in every geography where we have a presence, we have to build that last mile, that brick and mortar medical practice to come on board, right? And that is what we are in the process of starting to do. And this is kind of part of our formal launch, right? Is that we are going to focus very heavily on 5 geographic markets to start off with. As you can imagine, none of these services are limited by any means. From a geography standpoint, we have imaging centers in every metro area. We have surgical centers in case you need any procedures done, right? We have pharmacies all over. So all of these things are not geographically bound. But what is geographically bound is that office visit, so to speak, right? And so that's where it has to be sort of built out community by community, so to speak. And, this is really where one of our targets are our advocates, right? So we say, yes, you need to be a licensed broker to sell the insurance plan, so to speak, but you don't have to be a licensed broker to be an advocate for us, right? Because, so I'm actually going to share a different slide with you guys here quickly, right? Because an advocate is essentially someone who may or may not be licensed, right? But they are advocating for this free market system, right? And as you can see on your screen, right, what we do is we collect a service fee on everything that gets done. And then we share that service fee, right? We keep a percentage of it for ourselves. And then we're going to share a service fee with anyone who brought that patient, that consumer into the platform. Of course, the employer vertical is just one way for us to bring in those patients and consumers, but it's not the only one, right? And then we're going to share that service fee with anyone who brings in the doctors, right, in your local community, for example. And, so as long as we are sort of running this model where, it is an open marketplace and everyone is participating and everyone is helping us grow, right, we're all going to benefit. I remind everyone that, that our goal in this is not to be the provider of service, because there are a lot of great doctors and a lot of practices out there that want to work in the cash pay arena. And our goal is not to own the users or the patients either, right? Because there are a lot of people who can benefit from that. We just know that there is no standard way currently for these two parties to meet, right, in a sort of a continuum of care that is not only, for example, for one type of service, right? We want to be able to have our user come to one place, be able to get all of their services, all of their healthcare needs, so to speak, met in the best way possible with the price transparency that cash pricing can bring.
One thing to mention too is the fact that, the person really can operate their whole world in one environment. Some people go to a normal kind of a doctor, but then they also like to go to a chiropractor for adjustments. And there's no way they're going to readily make that happen in an ordinary world. But here, since everything's commingled, it gives them that opportunity. And then to emphasize what Dr. Arshad was just saying, for me, if I wanted to help anyone to participate in the healthcare field or even on the insurance side, you had to have a license. I couldn't let anyone who wasn't kind of in the inside club participate. But now if you're a LinkedIn expert and everyone follows you and you got all these doctors that follow you and you suggest they set up a free profile here, then anytime that doctor has a transaction, you're going to get a piece of that. And here you never were a licensed agent. And so it's really good also in that what I really like about it a lot is the fact that there's no ongoing costs. It's free to everybody. The consumer's free to download it. The doctor's free to set up a profile. The employer's free to put it into their operation. And the only time any money ever transpires is when you actually do something. Because how many products or services do you pay a monthly subscription? You never go, you never use the stuff once. I mean, like having AAA. I mean, I've had that for years. I've had to get maybe 2 toes in like 10 years. But still, I'm fearful to not have it because when I need it in the middle of the winter, it's great. But for a lot of stuff, it's just a scheme to get money out of you every month. So here, the honorable thing is, hey, my buddy's sick. He uses this 10 times a year. I use it once. I only pay a little bit because I use it the one time. And then everybody that helped make that food chain happen forever remains a beneficiary. So for me, the nice thing is, you always got to remember who brought you to the dance. And here it's 10 years later and you got that doctor on this thing and they're still generating appointments and you're still got revenue coming in. It's just a fantastic way to force, I hate to use that word, force the market to start to occur, because suddenly everyone's a stakeholder in us all doing what we already know is the smart thing we should be doing to begin with. But we're all just standing around waiting for someone to make the first move. Now everybody's got a financial stake in moving, and especially the doctors who really want autonomy and freedom once again. They don't want to wait forever to collect, their $70 in the end when they've been billing $200 for 90 days with 2 people in the front office trying to make that happen. This is spontaneous. Everybody knows what's going on, and the money moves instantaneously. So it's the perfect market mechanism.
Jeff? Dr. Ben's here.
Please chime in.
Yeah, just curious to find out whether there's anything in there that has to do with prevention or knowing where people are when they go in terms of their health and having some incentives to get them to be healthier.
Yes and no. I mean, that's part of like what's potentially going to be in there in a little broader way. At the moment, there's the opportunities, and maybe you could bring up what the image of the app looks like, but there's a little kind of a marketplace where there's membership options. One of the ones we typically give for the average person is your kid's going to need braces. It's going to be 2 years. It's a bunch of visits. It's going to cost you a fortune. A la carte. In here, you click on this membership. The doctor's offering a package deal if you pay cash in advance, like half the price or whatever the discount is. So what you're talking about is exactly the kind of stuff we want to start to showcase over there. And then ultimately we start to integrate some of that stuff within some of these care paths like he's showing here for this large group. But the challenge at the onset was to keep it simple. Like in our under 50 person program, we have 5 different unshared amount options. We were only offering 2 because to offer 5 suddenly it gets confusing and slows the process. And right now we're looking for penetration, recognition, and establishing this is the place. And then we're going to start adding all the extra stuff that'll kind of clutter it up a little bit when we want to put the jewelry on. This is what the app looks like when you log in as a consumer. And just so you know, if you're an employer, you have to go to the web because you have like a portal. You go in and enter information and click and change your employees. If you're a doctor, you've got to mark that the person was here, and here's where I mark up what I want to offer my service to be. And so they only work off the internet, but the consumer only works off their telephone. And that was where the rubber's hitting the road. And this is the whole thing they see. It's as simple as this. It's only 6 little tiles here. So where you see marketplace as an example is where you have some options inside there where it says memberships at the top. So the bottom one at the moment is just the health programs. And the top one is whatever kind of little offers we want to showcase. And then you get to promote them, because if you're a chiropractor as an example and somebody's searching chiropractor, there's 5 in the area, you come up on a list of 5. Well, what makes you stand out? Well, you happen to offer a special package with your operation and it's getting showcased over here. So we're able to kind of do what you're talking about a little bit, Dr. Benz, in our infancy and kind of this launch phase. But then, yeah, definitely and that's why I was trying to get back to you today. We definitely want to talk about kind of getting it expanded on a more integrated aspect of everything.
Do they do any evaluations of the employer group coming in to see how healthy the members are? Because then it looks like everybody's paying the same fees, but is that always
That's a good question, Dr. Arshad. How is that being managed? I don't know if part of that program.
Yeah, the costs, or at least the coding side of it, does run through the TPA and the carrier. So, they of course collect whatever, some amount of data to be able to generate a quote. I think one of the big targets, from a wellness standpoint in this marketplace, right, is the fact that when an employer knows exactly how much they can potentially save, right, and they know how much control they have, what's in their HRA account, what's in their ag accounts and so on, that transparency can allow them to then make those decisions that, hey, it is worth, for example, spending X amount of money per employee for a wellness program, right? And that, I think, makes that quote unquote sell a lot easier from a wellness standpoint, because you're actually going to directly see the effects of it or the benefit of it. Similarly, a patient, an educated consumer that can see how much their cost is, how much their care is costing them, I think is going to be a lot more motivated to participate in wellness, because they know that if they're not well, then they're going to have to spend more money down the road, right? So I think it's something that is, of course, desirable today, but I think it's something that we're really looking at 6 months down the road, 8 months down the road, that and certainly as we start to bring in and educate the consumers, hopefully, we would be able to drive that process a lot better.
It just sounds like there should be something where the savings are reinvested in a wellness program, because future costs are going to depend on that. Those young people are going to get sick at some point.
And that's certainly something that I think is a conversation for the advocates and agents to have with their employers, or, if they're bringing on individuals and so on, right? And certainly something that I think is for the wellness community to really be a part of.
Unfortunately, most of them don't know how to do that. And I think that Jeff and Charles will attest to this, that most of these employers and employees are fairly naive and uninformed. And that's why if you have programs that give them an idea of what their existing health status is through a more sophisticated and robust assessment tool of their existing health condition, then you can give them some incentives and say, if you lower your score by this much, we know we can keep our premiums at this level. But it sounds like their only exposure is when they have to use the system, and that won't give them a lot of incentives until it's too late.
Yeah, so I think, that's once again, I am presenting the software side of the argument, right? Because we're software developers, and I'm a physician by training, admittedly, but, we obviously, that's really an argument that has to be made by the advocate, by that agent to that employer, to show them the value of putting in a wellness program, right? We're not going to stand in the way and say, hey, don't do that. But we obviously aren't meeting with the employer either, right? So I think our goal was that let's bring transparency so that employer knows, how much they're spending, how much can they save, and then hopefully that leads to some better conversations in terms of, what other strategies, wellness and so on, can be put into place to better assess our risk and really sort of mitigate that.
Did I see a health savings account there? And if I did, are there any limitations on what the employee can put in? Because a lot of them won't let you put in nutrients, supplements, and other things. So what are the limitations that you would imagine on a HSA program?
Well, HSA programs are IRS regulated. It's whatever the IRS says, so, I mean, that's not dictated by the vendor. That's dictated by the government.
Some of the stuff can be, if it's incorporated inside that doctor's visit, and definitely with our medical benefits savings account option, that's also as a part of this, that definitely is an option to pay for things of that nature.
I mean, if we are talking about, if we're talking about the ridiculousness of HSA, because the government runs it, so you can pay for your copay using your HSA when you go see the doctor, but you can't use your HSA money to pay for your DPC membership, right? So why those vagaries are there, it's beyond anyone. So.
And then the other thing too is that this thing, as he said, has that Visa card to use outside the platform. So if you're in that situation where there's one local doctor, even if he's got 100 doctors in town in here, you're lucky the one you want to go to isn't, you can use the card and escape the app. So you can't look up and book the doctor in here, but you've got a card that's got the money from that HRA account on it. And you can just go to any local doctor, negotiate your own cash price, and pay with that credit card.
How do you negotiate that, Jeff? Because we know.
Well, exactly, and that person will get $50 if they tell the doctor, you really ought to have a free profile on this thing. I was going to book the appointment through this, and you're not on there. If the doctor goes on there and signs up for free, you get $50 as the patient, but then now your doctor has to post their prices, because that's the whole purpose. If I go through this app, I'm going to see every price, 100% all in, no hidden charges, no anything, with rankings and quality ratings and what have you. And then I can decide who's going to get my business. And, one doctor might be getting phenomenal volume and the other guy's too expensive. He's got like no appointments. So they don't have the luxury of falling back and getting arbitrary people shoved down their throat from insurance, because all I ever think of is a copay. And, you know, these insurance companies are paying at all different rates to these doctors. There's no hiding anything anymore. And so that really has really been the excitement. But for the doctor, too, is that every patient coming through this app shows up at your door prepaid at the price you dictated. But they're prepaid, and you don't have to do any billing or anything, or know any, even know the IDC codes of what you just did for that person. You just have to literally show they came to my office, I did what I was supposed to, and they've left. The money's yours.
Can they get the services of a nutritionist if they're licensed?
Yes, yes, totally. And that's why I said that's what's great about this, because you can appreciate this, because we've had this discussion. If you're got Blue Cross, the only doctors that get to be in there are allopathic doctors. Anybody else is like a witch doctor in their eyes. But in this app, everything is in there in parity. So if I'm bringing up a chiropractor, an acupuncturist, a back surgeon, you know, as a more sophisticated consumer today, where I don't have a built-in prejudice, and I've not been trained like a lemming to only think doctors at the Cleveland Clinic are meaningful and all the rest are, you know, heretics. I just see a parity. So now I'm seeing quality, parity, price, and I'm in control of and I'm like a kid. Mom and dad gave me $500 in spending money, and I'm in here picking what I want to do for a change instead of being forced down some path. So that's the chance now why I'm excited to allow the naturopathic world to finally accelerate out from the shadows, because they're finally on Main Street with everybody else instead of some back alley like they've historically been relegated.
I think that if you had acupuncturists and nutritionists on there, you'd be getting a lot closer to the prevention model at a lot lower cost.
You'll notice we've added in this appointments section, there's a way to search. We've been adding some holistic tabs and stuff in there, and we're going to do more of that as we start to populate more of them in there. So again, we're looking for these people to become a part of this, and now we can brag and point them in here. And you know, a fellow person in Pittsburgh can promote so-and-so in, you know, West Poughkeepsie, because you both happen to be in that same app type of a situation. So this gives a commonality that never existed before. And let's say, and here's another little step up. Let's say you're a part of some special smaller little group, like you do, I don't know, you do some funky kind of therapy, and there's 50 of you in the United States. All 50 can be in here. I could search to find all 50, because you're like a group within this larger yellow page listings, for lack of a better description. You know, you're an Ace Hardware store. They're all over the country, but they're in the larger directory here of hardware stores. But I'm looking for an Ace one, and I can zero in on all of that and stuff. So it really allows somebody to really build an infrastructure, like a lot of people have done on Amazon and the like, or YouTube, where they can build a whole business infrastructure on the back of somebody else's platform. And this being a total canvas where just providing the access, you're not providing any of these services basically at all, other than a venue for them to be found. It's fantastic, because now the market and the smart players and the entrepreneurs get to succeed. And guess what? Everybody else is going to fail, just as it should be. Because right now they're all propped up by insurance companies. They can be the worst doctor on the planet, and they're still somehow making six figures, undeservedly so. Am I sort of hitting the mark on that, Jawad? I hate to jump all over your parade.
Oh, not at all. I think Paul Roberts has his hand raised.
Go right ahead, Paul.
Oh, I'm sorry. I think I did it again where I didn't put my hand down.
Okay, well, I know Charles has had his up for quite a while, so sorry, Charles. Jump in.
Thanks, Jeff. And I was going to ask Colleen if she's available to maybe say a few words over her response from this demo and the previous demo. She seemed to be very interested in the potential of this to help small businesses and large businesses. I don't know, is Colleen available?
Sure. She is.
Sure. Hi there. I really, applaud all the efforts to bring this together. And, Jeff makes a lot of great points about just the marketplace in general. I mean, to some degree, we have to go out of the gates talking about this as an insurance product, because that's what we're all ultimately sensitive to at the highest level is I need to spend less. But once we get past that cost fear, cost barrier, whatever that is, you're paying too much, you're getting too little, Once we remove that part, then we can get down to the real problem that lies in here. And it's that, you know, physicians are limited in what they can do. We need to liberate them to practice medicine. We need to return small businesses back to the practice of doing their core competency, not being in business for the privilege of offering benefits. And then we need to empower the patient to make choices that they think are valuable for themselves, and also remove the cost barriers and access to that care. So some of the things that I think are very important here are, you know, as we as a nation are moving towards wanting to choose maybe some what we consider alternative methods of what we consider wellness, this app allows everyone to shop in a common place and select the wellness modalities that are important to them, and it gives them a way to pay for it, whether it's through their HSA applicable or their own credit card, or, you know, from an employer stipend, whatever it is. They have all of those things in one place, so it makes it incredibly easy to do, and it puts all the power of choice in the patient's hand, the employee's hand. When that employee is happy and feels they're getting a benefit of value, well, they're going to continue to engage. And we've been trying very hard for a long time to steer our employees from the self-insured perspective into these low-cost, high-value value providers that are offering transparent bundle pricing. But the challenge remains that the existing network, the systems, the steerage, the pathways that take it from referral to surgery, in that example, they don't allow for this marketplace to be seen because it's not beneficial to the larger systems. This now doesn't seem as though the employee is being told, go here because it's cheaper. They're actually being given the choice right in their hand, not telling them they can't do it, but we're using a different incentive. And now it is their choice to go to the lower cost one versus an alternative given by an employer. So I think that's very important. And to speak to the wellness perspective, I do agree, you know, that we have that concern of, oh gosh, you know, how will we control this, and you know, keeping them well. But one of the factors that has significantly impacted wellness is that getting access to care emergently has been cost prohibitive. I mean, we know that utilization is off the charts high when it doesn't cost them anything. They'll go when they have a zero copay, zero deductible, they're on a Medicaid service or what have you. So how do we find a balance in there to getting them that kind of care very quickly, get them the preventative care, whether that preventative care is traditional doctor, a DPC relationship, or acupuncture, that becomes the patient's choice, and then they feel good about being a participant in those options. And then if they get that care, I'd like to think that we will see a trend of educated decision makers who will then start to keep our costs down because they stayed healthier longer, got access to care before it was a chronic problem, and they will have participated in the stabilization of those overall high costs. And then if and when they need it, we've got a variety of different mechanisms in place to come together. And for the advocates that are, we really need to go out and just really bring the doctors to the table. They are one of the most risk-averse groups of people that we've ever known, but all they want to do is care for their patients. And the concept of doing something different that is really more of a business decision than a care decision is really uncomfortable, and they have a hard time finding value in it, especially if you can't turn around and say, my gosh, I've got 10,000 lives waiting for your services. If you can't say that, then they can't make sense of it. So what I love about this app is it removes the need for that doctor to engage in a contractual relationship with any one person, any one group, a geography, or anything. All we're asking them to do is, would you be willing, if someone paid at the front desk, to give them a simple price for this procedure? And if they say yes, and they have no risk, no cost in it, and they might get another patient for it, they're happy. And then once that physician starts to see that patient and he realizes his staff was really happy because there wasn't 17 layers of authorization, denials, etc., he didn't have to worry about whether they fell off the ladder in their living room or at work or outside, and all the meaningful use goes away, and he simply had a conversation with a patient, delivered the care, they were happy, didn't have to talk about money. The doctor will then walk away from that and go, wow, that was amazing. I felt like a doctor. Then that he will then share that with more physicians. So bringing the physicians to the table and helping them understand this is a serious path to liberating them and freeing them for their own medical decision making, removing the bureaucracy from their profession and getting them in front of people, not paper. That will be probably one of the most powerful pieces to this marketplace.
Colleen,
there's my thoughts.
No, Colin, and to finish along on your thought for one quick second, what's nice too, there's a lot of doctors that look enviously at someone that's a direct primary care physician, you know, and definitely understand how that could be better for them, but they're afraid to leave their insurance practice. It's just so fearful of what might not happen. It might not work out. And then what? You know, how do I go backwards? So now they have a way to like say, you know what, I'm going to keep my insurance stuff, but I definitely got X amount of slots a week that are open. I think I'll put a little listing in here and see if anything happens. So it's a great way for them to stick their toe in the water. Right. And the minute they get a couple of those coming in, like you said, how are you not going to love a prepaid patient with no paperwork? You're like, man, that was great. I got to be the doctor again. That was fantastic. So it's a way to win them over. I think, Dr. Benz, were you going to respond there for a minute?
Yeah, I just think it's always good to have a bit of reality thrown into the equation, because all the doctors that I know that are good, they're booked 2 and 3 months in advance. They don't have any openings. And as far as the insurance companies go, they're now promoting programs for self-funded companies where the employees can actually get a lower deductible and a lower copay if they're healthier. But they have to submit to some additional testing and evaluation to find out what their exposures are. But if they can treat those exposures and get down to the level where they don't have any high risk factors looking at them, they end up getting in a preferential pool for deductibles and copays. And whether it's weight loss or smoking cessation or chronic disease, they gain points every time they do something that improves their health. So if you have programs like that that are advancing every day, and doctors that are so busy that the good ones really don't need to do anything to incentivize because they're already up to their eyeballs in patients, these things are going to create some challenges, I think. And that's what I'm just trying to do, is just say, you know, you have to take care of these things too, because all doctors aren't good and all insurance companies aren't good. And the employers are right now, the ones that I'm working with, they're all looking for these kinds of cost-saving options, but they want functional medicine and they want employees to get bought into the system so that they're buying into their risk and they're taking initiative to improve their health. Other than that, I can't see how the system can actually motivate people to do anything.
You know, I think you're absolutely correct. You know, there are physicians who are, of course, booked solid 3 months out. However, these same physicians are spending about 80% of their time in paperwork and not in patient care. So I can tell you as a physician that, you know, I spend more time sitting in front of a computer doing paperwork and clerical work than I do sitting face to face with my patient, and that's true across the board. So I think, you know, this idea that physicians are booked solid, well, yeah, they're booked solid doing a lot of busy work. They're not booked solid doing meaningful work, right? As a physician, my meaningful work is to take care of my patient, not to sit on the computer clicking away and answering pre-authorization calls and on the computer phone with the insurance company. So I think there is a bit of a misunderstanding if we think that physicians who are really good are so satisfied in their clinical environment. They are not. As far as I think, you know, of course, insurance companies are sort of obviously kind of looking at the same landscape that everyone else is, right? And they're saying, hey, you know, okay, so what can we do to really reward those who are willing to go the extra mile? But what percentage of population is that? What percentage of the population is really going to fall into that preferential pool, right? And everyone else is going to still have to suffer through it. So I think, in our opinion, the best thing that we can do for healthcare, just like any other business, is to bring transparency and to connect that user directly to the provider, because that's going to be the most meaningful interaction, out free of other vagaries of claims and paperwork and what have you. And clearly it is a work in progress, right? Nothing ever comes out of the gate addressing 100% of the concerns of the market. But certainly we feel that this is the best start that healthcare market can get.
Dr. Willems, I see you have your hand up there.
Yes, okay.
There you go.
Hi, Jeff and Jawad. And good to hear from everybody. Colleen, that was a great discussion about what drives physicians. And Jawad, you're right. The good physicians are usually looking for a way out of medicine because of the fact that they can't be as good as they could be. Jeff or Jawad, do you want to address, or Charles, the option of the network of excellence opportunities here using a nurse navigator, and perhaps even saying for an E&M code is a zero copay or zero fee for the patient, or some other way to motivate them to come in and look at a network of excellence option with your plan.
Yeah, absolutely, Brad. So I think one of the things that I keep kind of coming back to is that the number one thing that we need to do is bring transparency, and then bring some degree of control back to the consumer, right? And when I say the consumer in the health plan sense, it's not only the employee, it's actually the employer more, right? Because they are really the ones purchasing that plan. So one of the things that, of course, a network of excellence, one that, for example, your group brings in terms of orthopedics and so on, because we know, for example, that 80%, right, or so, you can correct me, but I think it's about 80% of back surgeries are completely bogus, right? They're not needed. If anything, they lead to more problems, more narcotic use, more whatever, right? It doesn't actually fix the problem. But we know that statistically, there are a lot of treatment options out there which can help. It's just that some of these options don't actually use, your traditional pharmaceuticals, and therefore have had a real uphill battle in gaining traction to be paid by your traditional carriers. So if on the other hand, if the employer through the HRA is the one that's controlling some of those funds and has more visibility, well, they are going to be more motivated to come to treatment plans that may be a bit less traditional than what we're used to. And I think that's really where the opportunity is for us to steer those individuals and steer those users, including the employers, towards these centers of excellence, towards these physicians who are willing to be sort of paid based on the work they do and not how well they can navigate the paperwork.
Do you have any information on where the science is for the better options to the back surgery? Because I agree with you in theory. Most knee surgeries don't turn out to be that effective either in terms of resolving pain. But when you break it down, there are some that are necessary, whether it's knee or hip or back. And it's the same with a lot of other things. Lots of the medications aren't very helpful either. If you look at the medication advertisements on TV, you'll see there's diabetes, there's depression, there's other things that they're saying. They're admitting that their existing medication doesn't work. But if you take this other one in addition to it, then you're going to get more benefits. So the whole system, whether it's the surgery or the medications, is totally broken. And I don't know how you're going to screen for which of the programs really have the proven efficacy, because excellence depends on science. And so where does the science come from to guide people to make these kinds of choices?
So I think this is a great segue, perhaps. I know that we're coming up over the hour, but maybe if Brad, you'd want to jump in a little bit about ADX, right? Because I think that when we talk about orthopedics, especially, right, but hopefully this concept really grows to other fields of medicine. But I know that Brad's group is really focused on orthopedics at this point. Really, I think maybe he can give you some insight on that.
Sure.
Yes, Brad, I was going to say, why don't you bring us home for tonight?
All right, well, thank you. And is it Dr. Benz, Charles Benz?
Yes.
Excellent question. And you've identified the whole root cause of the problem with the current system, is that there's nothing wrong with fee-for-service as long as you're accountable to the patient and the outcomes. And what we have right now is the worst of all worlds. We have fee-for-service with price fixing. And so it motivates quantity of crap and punishes quality of care. And so ADX was started as a network of the very best and brightest that we can find. We're always looking for talent. So it's an exclusive network, but all you have to do to be in it is to be great. Now, how do we know that? Well, with 10 years and almost $3 million of software development and investment in this, we actually track meaningful outcomes, patient functional scores, medication usage, cost, number of procedures. All of those things are benchmarked per diagnosis. The current problem focuses on the cost of an individual procedure, which is the tree, and completely ignores the cost of the forest. And so ADX came about turning it on its head and tracking those outcomes and incentivizing results and giving almost instant feedback to the doctors that are in that group to see how are they doing compared to their peers. And that's what attracted me to Jawad and vice versa, is that we've got such a unique product here, we can offer that to this network.
Good. You're moving in the right direction. And now, as Jawad said, all of medicine has to move in that direction. One of the problems is that the existing clinics and healthcare providers are using an excellence model that's based on processes. When you look at the Baldrige Award or all the excellence awards for healthcare in the 42 states that have equivalent excellence awards, 100% of the outcomes have to do with the processes. In other words, there are no outcomes. It's just, are their processes really working well? And they're giving awards to clinics and other healthcare providers. And when I challenged them on it 3 or 4 months ago and asked them if they had any outcome measures, they said no. And I said, well, how in the hell can you provide any kind of medical services without having outcomes as your benchmark? And then they said, well, do you have anything that you could submit to us that could help us to be guided on this? Which I thought was crazy. I'm not the foremost expert on healthcare in the world, but I was able to put together an article that showed them how to get outcome measures and how to use prevention as a tool for the healthcare system. I don't know whether they're going to use any of it, but I sent it to them and I published it. And so it's out there for people to look at and see. And I'm hoping that you guys are moving in that same direction.
Well, I can tell you we absolutely are. And now we know that we do, as I probably mentioned, 30 to 50% fewer procedures with better results. We're innovative, so we're using a lot of regenerative medicine, and that has reduced our surgical referrals for shoulder rotator cuff repairs by 80%. And we're constantly moving the bar forward with it. And you're exactly right. It's all about what matters to a patient, not paper. Did I fill out all the forms? But did I actually get you back to your normal function? And that's the direction we need to move. And that's where innovative thinkers like Jawad and Jeff and Charles and everybody on this call are going. And that's what we can offer in the self-insured, self-funded market or the cash pay, and but not in the BUCA, Medicare, Medicaid, because they're not going to change. But we have a great opportunity in this market where we're accountable to the true client, which is the patient and the employer.
That's really very good. I'm just going to slip one last question. So we already are past our time slot, but I see Jason's got his hand up, so I'm going to let you get the last word in.
Hello, everybody. Great presentation. I slipped in here, kind of fly on the wall out of respect for Charles. But after seeing the presentation and hearing pitches all day, and listening to tech startups, I want to say first that I'm absolutely floored just by the sheer audacity and of what we're talking, the depth of what we're talking. It is no less an absolute revolution, and I don't get to say that very often, even though I hear pitches every day. But now diving into where I get lost is, though I don't understand the majority of it, and I will not dare speak in anything other than outside of the advocate's point of view, and most of this was behind the scenes from those inside insurance and the healthcare point of view. So again, I can only approach my question or my confusion, and it may be because I am naive, as it's been described as advocates are. I will say that in the investment world, that when you have to educate the consumer, that it is deeply expensive. And what I do understand here, that I see every day when we deal with startups and we try to launch them, that in knowing that you've already raised what you've raised, it seems to be the exact same problem you have that the startup down the street has. How do you go from today and you get scale? Because scale is where all businesses cut their teeth. And maybe I'm being overly simplistic, but scale is where, again, I think businesses do cut their teeth. And it's being said that the advocate is taking this last stretch, going to the brick and mortar, and it is very well said. I agree with whoever is the one that made the comment that you still want to go into that local visit. But as I read your website and I'm listening to the behind the scenes, maybe too close to the forest, I don't know, or I just don't get it. I don't see where the advocate, like how it can be fair to put that onus if the last stretch of this hurdle to go from however many users with client adoption to go from where we're at now to say the 10,000 you need to get the mass appeal to, the numbers you need to stimulate the herd mentality, where once one person starts joining, everybody else starts joining. To stimulate it, I don't see how you're giving the advocate, in this case, the layman like myself, the information to have the buy-in for what's in it for me. There's a lot of good word being said, and trust me, I'm for this. What I'm hearing, I'm enamored with it. Again, it's nothing short of, this is a complete changing of a paradigm in solving a very big problem with very smart people. And that's clear in my very first call, that I'm just trying to ease in on the backdrop. But if you're trying to get the advocates, the people like me, to walk in and get buy-in, there's nothing tangible you're giving me. It's just all these big hypothetical, it will feel, you'll save money. Well, you don't have that data yet. And I think that in my world, the biggest risk is to take something that is theoretical or something that is hypothetical, no matter how beautiful the code is or how great the engineers from MIT, how great their algorithm is, and it solves cancer. If the marketing people on the other side of the coin can't convert that or express that to the consumer, you've lost from the beginning. And I know that because I've lost more than I've won from the tech side. And so that's where I speak from. And so if this last leg, to go to the brick and mortar, is I think that the great minds that are on this team, whoever, whether it's the engineers or the marketing because I don't know who the individuals are I'm speaking to. I think we need to give them something more tangible so that we don't have to assume, so that we can remove the theory and we can remove we got to remove the fog of war. This is so high level, I can't even articulate. You need to get the consumer, someone like me that wants to go out in my community. If I'm sitting with the mayor tomorrow and I want to pitch this, I don't know what I'm pitching other than I'm just saying this is revolutionary. That's not enough buy-in to get one wallet, to get me to want to actually talk about it to my next door neighbor, my doctor, or the mayor, sitting across the street. I think that you've already answered your own question, if I may. and you've mentioned a kind of there is financial incentive all the way around. And we're talking about it in another way as being transparent. I think that's exactly the answer. If you look at every tech around us, there's tried and true marketing methods of influence. I think they're being dubbed influencer marketers nowadays, or affiliate of the old day, but nobody wants to be those. If you could give those affiliates something more tangible than I've heard herein, then I think that right there's your 0 to 10,000. And once you get and I'm just using hypothetical numbers, once you get your large enough number, then I think the snowball will hit. But just remove the fog of war, because despite how great and how everybody on here probably wants this to come to fruition, it's the plebs like myself. There's such a huge gap that it's either do I raise my hand and ask this question and embarrass myself or can't even articulate what I'm trying to express, or do I just get off the call and move on and pay my Blue Cross Blue Shield?
No, Jason, I love that question. I'm going to chime in first, and I definitely want to get some other responses.
I think to be specific and to speak professional, I'm speaking about market strategy.
But the truth is that, what tonight, unfortunately, was more geared to a different audience, because there's a fair amount of what you're describing sort of already in place. And that is really one of the advantages this brings, because having tried to connect a lot of people for a long time, there's been no ecosystem to attach them to help accelerate and make happen. And now, because we're able to bring employers on board, the doctors are ready to be there. So it's become a real good chicken and an egg for a change situation. But I saw a couple other comments real quick too, and then we'll dart out of here tonight.
Yeah, I'm a direct primary care doctor. I'm sorry. Go ahead,
Dr. Tinsley. I see that you're in here. Go right for it.
Yeah, so there is a video on YouTube. Mark Watson spoke at the John Locke Society that I think, who was just speaking? It can clear up a lot of your questions, Mr. Feimster. If you watch that video, it says it's an hour long, but he really only speaks for 30 minutes and then has a 30-minute Q&A. But he's one of the directors of Union County, South Carolina, and they switched over to a self-funded plan with a DPC doctor, and they saved their county $1 million in 1 year.
I don't understand I don't know if I want to spend 30 minutes or what consumer will give you that, and I apologize. I spoke to the wrong audience and risked that. No, I do not know a consumer that will give you 30 minutes, and I don't know how much
company. I think a company owner who wants to save, $50,000 for his company is going to spend 30 minutes.
As I say, every startup that they come and they say they're the Facebook of X or they're the Uber of X, how does that relate to you? Tell me you, because today we're talking about you. That's all I mean.
Right. Well, I'm taking this video to a patient of mine who owns a 70-person company, and I'm going to show it.
Is it yours? That's all I'm asking. And I'm glad that this doctor saved money somewhere, but again, bring it back to you. And what does that mean for me? That's all I'm asking.
Right. Well, unfortunately, we don't have enough time to totally get into this discussion. It's one for us off camera or, on a different occasion. But real quick, I got to kind of end our little recording because we're way past our typical allotment here. So, Dr. Arshad, I definitely appreciate you being on here. All those outside comments, fantastic. So, thanks very much for sure.
I appreciate that so much, Jeff. And Jason, I will ask Charlie to connect us, because I think that hopefully we can address a lot of the things that you have talked about, because as you can imagine, none of these